today. I wanted to go over a few logistics real quick before we get started. One, we are recording this meeting today, so we can have it for other folks to watch in the future. We also encourage you to put your questions into the chat box throughout the meeting, and at the end we will have time to go through those questions and respond to them. And we also ask that you please keep yourself muted until the end for the Q&A. If you want to unmute to ask a question, that's fine. So again, we will go ahead and get started, and we welcome you to this webinar. So this is all about enrolling as an Illinois Medicaid diabetes prevention program and diabetes self-management and education support service provider in IMPACT. It's a guide for you all as providers. And my name is Jana Simon. I'm a program director at the Illinois Public Health Institute, and we are helping to host this training today in partnership with the Illinois Department of Public Health. So just a real quick background about why the Illinois Public Health Institute is helping to host this training and how we got here today. We have been working closely with the Illinois Department of Public Health and the Illinois Department of Healthcare and Family Services in collaborative work over the last few years to really move towards Medicaid coverage for diabetes prevention and management services. We've hosted several large stakeholder engagement meetings over the years and have engaged with many of you directly in getting input into what coverage might want to look like here in Illinois. Over the last year or so, with support from the Centers for Disease Control and Prevention and the National Association of Chronic Disease Directors, the Illinois Department of Public Health and Illinois Department of Healthcare and Family Services was part of a national technical assistance initiative called the 618 initiative. And that really helped propel forward the full roadmap and operations guide for coverage here in the state. And as you know, the provider notice from HFS was just issued on Friday for these services. And we're really excited to look forward to implementation of coverage in Illinois. There are also two grants in the state of Illinois that are promoting diabetes prevention and management and increasing availability and awareness of services. And those CDC grants are one through the Illinois Department of Public Health with the Illinois CARES, and one through the Illinois Public Health Institute, known as Chicago CARES, which you may be familiar with both of those programs. So really excited today as part of those grants through the Illinois Department of Public Health to bring this training to you all to help give you assistance in learning about the new coverage options and learning how to enroll as Medicaid providers. Just to give some really brief background, as you know, the number is growing of people who have been diagnosed with type 2 diabetes, and also awareness of prediabetes has been growing. We only just started tracking it, as you can see in this chart, in 2014. And while a small percentage of people have been sort of screened for prediabetes, the number is growing, and we estimate that about a third of adults have prediabetes, many of them who do not know it. But we definitely need to continue to address both prediabetes and the management of type 2 diabetes. And as many of you are aware, there is a national diabetes prevention program. It's one of the largest national efforts to really mobilize and bring evidence-based lifestyle change programs to communities across the country, and has been sponsored by the Centers for Disease Control and Prevention. We are specifically talking about this program when we talk about diabetes prevention here in Illinois. And it is a year-long lifestyle change program. So the program goal is to really help participants make lasting behavior changes, increase their physical activity, lose weight, improve their eating habits. And it's done over the course of a year. So the first 6 months, there are weekly or bi-weekly sessions. And then the remaining 6 months, there's sort of these maintenance sessions. And they follow a standardized curriculum, and they often offer peer support and assistance from a trained lifestyle coach. And the goal of the program is to lose about 5% of the person's body weight, which has been shown to help reduce their risk of type 2 diabetes by about 58%. So this program has a strong evidence base that shows it really is effective in preventing or delaying the onset of type 2 diabetes. The program is delivered in person. It can be delivered distance learning. So this is something like a remote telehealth platform. It can be fully online, a full online experience, or a combination of any of those. And it is a recognized program by the Centers for Disease Control and Prevention. So there is a recognition status that programs have to apply for and maintain certain level of standards to meet that recognition status. There's a registry of organizations that have this recognition status. And again, they have to meet a set of quality standards called the Diabetes Prevention Program. There's a standards and operating procedures book that gets updated. And they give constant feedback to the CDC to maintain their status as well. So here in Illinois, what is diabetes prevention program coverage? The enrollee eligibility, we're really looking at adults ages 18 to 64. Medicare does cover this program. So for those 65 and older, they would bill Medicare first, who are meet the criteria for having pre-diabetes. So they have to have a certain body mass index and have a history of elevated blood glucose levels or a history of gestational diabetes. If you are currently pregnant or previously diagnosed with diabetes, you are not eligible for the program. So we're really looking at the pre-diabetes range for this program. Referrals and pre-authorizations to the program are not required in Illinois. A referral, of course, is accepted, or enrollees can directly enroll in the diabetes prevention program if they meet certain criteria and show recent blood test results to the DPP provider. The CDC recognized organizations will enroll as organizations, and our consultant will talk more about that in a minute. And the organization is the billing provider in Illinois. And again, this is from the provider notice, and the full details of all of this are, of course, in the provider notice from HFS, but you can see that reimbursement is based on billing milestones that have national Fqhc codes. Those milestones are a combination of attendance and weight loss outcomes. And you can see this, you can look at more detail again in the provider notice, but you can see there are these 5 billing milestones plus a performance weight loss value extra payment if someone loses 5% of weight loss throughout the year or at any point in the year. So that's for the prevention side. Also with this new service is looking at the management side. So the diabetes self-management education and support services are actually a set of evidence-based services, sort of a wide-ranging set of education and support services that help people with diabetes navigate the disease, manage their diabetes, and hopefully have improved health behaviors and improved health outcomes through these programs. Again, these DSMES programs follow a set of evidence-based standards, and there are 2 organizations in the US that determine that the standards are met: the American Diabetes Association and the Association of Diabetes Care and Education Specialists. And for Illinois Medicaid, a DSMES program seeking reimbursement in Illinois Medicaid must be accredited or recognized by either of those 2 organizations in order to seek reimbursement. Again, DSMES is provided in a variety of settings. It can be didactic or sort of person-centered empowerment models. It can be offered one-on-one and individually, or in a group visit of 2 or more folks, and in a variety of settings. So everything from classical outpatient clinics to home health, public health departments, area agencies on aging, work sites, et cetera. So a wide variety of settings. And often led by multidisciplinary team. So at least one team member has to be a registered nurse, registered dietitian, nutritionist, pharmacist, or other healthcare professional that's certified as a diabetes education specialist. Or, but the teams also often include many more workers. So community health workers, mental health specialists, exercise physiologists, et cetera. Again, this is for people with type 2 diabetes. And again, because Medicare covers these services, this is for folks under age 65, because Medicare would bill for those older than 65. And it's, of course, with type 1, type 2, or gestational diabetes. Referrals are required for coverage for DSMES in this case. So a written referral from the treating qualified provider is required. And again, if someone is on Medicare, you have to bill Medicare first. And again, just like the diabetes prevention program, organizations who have an ADA or ADCES recognized DSMES program will enroll as DSMES providers in impact. So again, it's the organization that's the billing provider. And this is the reimbursement rate, again, using national Fqhc codes. Individual sessions are reimbursed at $55 per unit, and a unit is 30 minutes. And group outpatients to 2 or more folks. This could be a, just an outpatient visit with 2 folks, or it could be a full, 8-week-long lifestyle change program that many are offering as a diabetes support service. And that's $16 per 30-minute unit. And so we can answer questions at the end. I think if you have any questions about these specifics, we can get them in there, but also questions specific to the provider notice should be dealt with through HFS and the contact they provide there. So I will now go ahead and turn it over to our fabulous consultant, Lindsay Artella, with Sage Health Strategy to really go into the training specific to Medicaid enrollment today. So Lindsay, I'll turn it over to you. Thank you.
Thanks, Jana. Good afternoon, everybody. And thank you for your interest in this program. My name is Lindsay Artola, and I'm with a firm called Sage Health Strategy. We really specialize in government-sponsored programs, specifically Medicaid. So we do a lot of work here in Illinois with a lot of the health plans and Medicaid providers. You don't need to, I just wanted to put that in there so you know who I am, but let's just go on through because we have a lot to cover, and I want to make sure that we have some time at the end for questions and conversations. So just a reminder, today is just the first of our training sessions, and we'll be focusing on just how you get enrolled with the state and the MCOs as a DPP or DSMES provider. We will also follow up in September with a second session. We'll do 2 instances of the session on how you file a claim. Really the basics of claim submission, what you need to put on a claim, how to submit the claim, how to deal with denials and rejections, and so on and so forth. So make sure that you register for one of those 2 sessions so that you're ready to go with filing claims with the MCOs. So for today, I'm going to just do a couple of opening remarks on the MCOs and the Medicaid program. We're going to spend the bulk of our time walking through how you register and impact, because that is sort of the foundational piece if you want to provide services to Medicaid recipients. And then alongside the impact registration is something called the MCO universal roster or the standardized roster. So we'll spend a little bit of time on that, because if you want to build the MCOs, you're going to have to fill out the universal roster and submit it. And then hopefully we'll have a good amount of time for questions and discussion at the end. So just in terms, if you're new to the Medicaid program in Illinois, I wanted to make sure folks had sort of that foundation of who the players are. In Illinois, the Medicaid program is known as Health Choice, so you'll hear that thrown around a lot. I'm sorry, I didn't even check. Is my screen share showing?
Yes, it is.
Okay, perfect. So yeah, you'll hear discussion about Health Choice Illinois. There are 5 now players, MCOs, that if you are in the Medicaid space, you will probably want to reach out and talk about contracting with. We have Aetna Better Health of Illinois, Blue Cross, Molina Healthcare, and Meridian Health. Those 4 plans operate statewide. So if you operate outside of Cook County, those are the 4 plans that you are going to want to partner with on your program. Within Cook County, those 4 plans are also in Cook County, but there's a 5th player, County Care, and they only cover the county of Cook. So if you are within the Cook County region and mainly serve folks that are residents of Cook County, you will also want to be talking to County Care. And then finally, there is youth care. I don't think that will apply to this population, or it will apply minimally. That's for kids that are in the foster care program, and that's administered by Meridian Health. So again, if you serve folks that perhaps are in the foster care program, you'll want to talk to Meridian Health as well about that population. So those are the 5 plans that manage the Medicaid program for the state of Illinois. And I did want to mention that IMHIP, the Illinois Association of Medicaid Health Plans, has a comprehensive billing manual. It's found on their website. You can find the link down here. And it has just a whole host of information about how to bill the Medicaid managed care organizations. Has a lot, every single provider type has its own chapter. We will be adding one for DPP and DSMES providers. It's not complete yet, but we're working on that now. And so just make sure you bookmark the IMHIP website so that you have access to that billing manual. And again, it has a lot of great resources in terms of both submitting claims and, again, a lot of the stuff that we'll cover in the second session around claim rejections and denials and correcting claims, et cetera. So just a really fantastic resource to make sure that you have in your bookmarks. So let's dig in with the impact system. which is the first step in getting to be a provider in the Medicaid system. So impact, which does stand for something, but I can't remember what it is, something about cloud technology. I know as the CT is cloud technology, but we just call it impact. It's a fully online system run by HFS, and it is the way that the state credentials providers. So it's a way for the state to know that you as a provider have the right licensure or certification, educational qualifications to provide particular services to the Medicaid populations. It is the only source of credentialing for the Medicaid program. It used to be that the MCOs would credential providers all on their own. Now it's all done for the state. Once you're credentialed with Impact, the MCOs will accept you as a Medicaid provider. However, credentialing, showing that you have the right credentials, doesn't necessarily mean that you can just go out and start providing services to a Blue Cross or a Molina member. You actually do still have to enter into some sort of contractual relationships with those plans, sign a contract, and they will have, certain operational requirements, including the MCO universal roster that you will have to meet before you can begin billing them. So we'll talk a little bit about that. Roster is one piece of it, but if you are currently contracted with an MCO and you're going to add DPP or support and management and education services, I would work with your provider rep, just let them know that you will be billing for these services, make sure it will be covered by your current contract. If you are not currently contracted with MCOs, you can go on each of their websites and they will have information under the provider section on how to become, or how to reach out to get a contract. And we'll follow up after the presentation with a list of those contacts and websites so that you can begin those conversations with the MCOs. So when you're going to submit a lot of information into Impact, and that file goes over to the MCO so they know that you've been credentialed, but there are certain things that don't come over on that file, and there's certain information that is required by regulation or statute. The MCOs have to put in their provider manuals, provider directories. And so they've created this universal roster that just asks for a few more detailed information. But again, we'll get to that towards the end of the presentation. So Impact is all about credentialing and showing that you have the requisite certifications to be able to provide service to a Medicaid recipient. It is all online, as I mentioned. There is a great resource webpage that I've given you the link to here, has a glossary of terms, a lot of FAQs, and just some great presentations and recordings on Impact registration. So I highly recommend, again, bookmarking that one as you go through the process. You can usually find what you need within those resources. How you register an Impact is going to directly affect how you get reimbursed by the health plan. So it's really important that you submit your application with very accurate and complete information. Make sure that all your locations are in there, that you've added the specialties and subspecialties that are needed. And most importantly, and we'll talk about this, that the taxonomy number that you register with an Impact is the one that you use on your claims and the universal roster. If that taxonomy code is not the same on the roster, what you put on Impact and what you put on your claim, it will get rejected or denied. So it's really important that you pay attention to that taxonomy number. So it's an online system, as I said. Once you start the registration process or the application process, they give you 30 days to complete it. So we always kind of want to give you this checklist at the beginning to make sure that you have all the requisite information you need, so that when you go in and begin the process, you don't have to do a stop and start to go find something and chase something down. So the first thing that you need to do is get your National Provider Identifier number, your NPI. You will be getting a Type 2 NPI That's an organizational NPI as opposed to a type 1, which is an individual clinician. So you can go to the NIPS website that's listed there, and it's a fairly quick process to get your type 2 NPI. Make a note of this taxonomy code. It was also in the provider notice. It's a 10-digit code. That is the taxonomy code for both DPP and DSMES services. If we have any Fqhcs on the line or other providers that are already with NPIs, you will need to get a new NPI number in order to bill for DPP or DSMES services. So it's similar to if you're an Fqhc that provides super services, the substance use disorder services, you also had to have a separate NPI. It's the same for DPP services. You'll have to obtain a new type 2 NPI in order to bill for these services. You will need to submit, if you're going to bill fee for service, there will always be a few Medicaid recipients who are not in Medicaid managed care for one reason and another that we don't have to go into the details here. But you will need to make sure you have a W-9 on file with the comptroller so you can bill fee for service. Make sure you have all your licensing and certification documentation handy. Confirm within your organization what primary email you are going to use for your impact registration. One of the things that we recommend is rather than having a staff member email, that you create an impact mailbox specifically for the impact system, so that if you have staff turnover or a number of different staff involved in this, there's one central email where all the impact communication is going. Oftentimes we've run into clients who, a staff member has left, their email, has been disconnected or deactivated, and then, they run into all these billing issues, and it's because some impact has tried to communicate with them and they're not getting the emails. So we really recommend that you set up a separate email box specifically for impact. You just need to make sure your internet browser is up to date. And we'll talk about this in a minute. You're going to have to begin the process with creating an impact account, a single sign-on. And we'll talk about that in a minute. Make sure that you have your provider type specialty information handy, as well as I said, your licensing and certification requirements. We will have that slide later in the presentation, so you will have that handy. It was also in the HFS notice as well. And I don't think this last checkbox applies to this population, so I think you're okay there. So for impact registration, there's 3 major steps, and we'll go through each of these individually. The first is to create your impact account, your single sign-on. Then you have to request access to the impact application. And then the third step is to complete and submit that application. So we're going to go through each of those individually. So to create your single sign-on, you're going to go to the impact website. This is the link here. You can also just Google HFS impact and it'll bring it up. So you're going to see this come up on the main page. All you have to do, and it's confusing because it says log in and you're like, well, I don't have a login, but you just go ahead and click that button and the login screen is going to come up, and you're just going to hit create new account. And this will be the next screen you see. There's 4 steps you need to take. You are registering as a service provider. So you're just going to click that radio button, hit next, and then it's going to ask you for some information. And this will be the staff member, usually in the billing department or in some, billing capacity, who's going to manage the impact account for you. So they're just going to want the main email contact of that individual. And you're going to hit next. And then you're going to create your user ID and password and some security questions. So again, if you are going to do like in that go back for a sec. Whoops. Now I don't know how to go back. When you set that primary email up, that's going to be your impact at fqhca.org. That's going to be your primary impact registration email. And then you will have the opportunity to add staff member emails in that last screen. And I apologize because I can't seem to figure out on my screen. It's not letting me go back. Give me a sec. Pardon me. Get out of. Oh, what did I just do? I apologize, guys. All right, let me just go back here. All right, so on this screen, sorry, you can put someone's name in there, but for the email address, I would put, you know, that impact mailbox that you're going to use as your primary email address with the phone number of the organization. You know, the verification question is just something that the state puts in there. And then you're going to hit next. And sorry, so this is where you'll create your user ID to log in. Create some security questions, and your account has been created. So that is how you create that single sign-on. And you're ready to go to the next step, which is to ask for application access. So we've completed step, we have our impact account now. We're going to go in and request application access. So all you have to do is sign on. Once you've created your single sign-on, your account is ready and activated to go. You're going to go back to that login screen. You're going to log in, user ID, password, and this is what's going to come up as your options. And you're just going to request application access. And there's different ways you can get to the impact application. You can either just put impact and hit search, and it'll give you the options, or you can just hit state of Illinois, and based on your login, login, it should show up as impact, and you just check that. You just select the agency, HFS, select impact, and you'll see it comes up. So it's not showing on the screen because it's not a live training, but when you hit state of Illinois, you'll see you can pick you're going to pick HFS, and then click impact. It will show up, it'll populate in this box here. And then you're just going to request access and go through all the steps. There's a number of steps. We don't have time to go through every single screen, but it's just basic information, very easy to follow. And you're going to get that application access, and you'll get an email that says you now have access to that application. So let me pause there, because before we get into the actual application process, I just want to make sure that there aren't any questions specifically related to the single sign-on, et cetera, et cetera.
Rebecca from our team is tracking questions in the chat. So I think a lot of the questions refer to things you'll talk about later, but Rebecca, was there anything specific to the creating an account?
Okay, I'm just going through here.
Well, they're specific to NPI, but I'm not sure if we want to touch on that later more.
Yeah, why don't we ask that? So one of the questions, you can read it, Rebecca, go ahead.
So will this process differ at all for rural health clinics or Fqhcs?
That's a great question. And I should have said, when I said Fqhcs, I meant all encounter rate clinics. So whether you're an RHC, Fqhc, or a ERC, encounter rate clinic, it's the same process. You have to get a separate NPI from what you use to bill your traditional encounter rate services, your T1015s. So you will have to get a new type 2 NPI and register as a new provider.
And Lindsay, is that true if you have a type 2 NPI that already has the same taxonomy code? Do you still need another one specific to these services?
I'm not sure if anyone would already have that taxonomy, because are they billing?
I think it's a health education taxonomy.
Not specific to diabetes?
Jill mentioned.
I thought the taxonomy code was specific to these services. So that's why that may be an HFS question, to be honest, Jenna. I thought the 174 taxonomy was specific to these services. Are they, I guess the question is, are they already registered at Impact with a separate type 2 NPI and that taxonomy code, and they're billing currently for Medicaid services?
Yeah, for the person who asked that question, if you want to add more details to the chat, we can maybe help figure it out at the end. And then the last question that just came through is, if they already have an account, will they need to create another one?
If they already have an account.
An Impact account.
No, if you already have an Impact account, you should not have to create a whole new Impact account. You will have to create a new application, but you won't have to create a new Impact account.
And one more just came through. Will we need a separate NPI for each rural health clinic location, or one per rural health clinic location, or one per TIN?
So if you currently as a rural health clinic have more than one location, but all your billing goes to, like, you have an administrative NPI where you're billing to, you just need that one NPI, and the locations are separate, but you're always billing through that one location. That's how most ERCs, RHCs, and Fqhcs, they have multiple locations, but the billing provider is always the same. Because there's no rendering provider the way it is in traditional medical behavioral.
And I see the clarification around the health educator taxonomy.
Well, let's see.
I think we can cover that towards the end. Yeah, it's already an existing taxonomy. We're just
that might be actually an HFS question, Jana. But let me take that one back. That's a very, very good question. I appreciate someone asking it. So we'll have to take that one back, because I just want to make sure that we get you the right information.
And one more clarification, I think, before we move on. It says the taxonomy cannot be simply added in Impact and NPPES.
It depends on the type of provider you are, I guess. If you are already registered in Impact, this is a separate, I guess, provider category, similar to if you were, again, a health clinic that was providing substance use services. You had to create a whole new registration to be a provider for those services. So it's the same with the DPP, DSMES services. You have to create a whole new application and a whole new NPI number, et cetera, et cetera. I'm not sure that answers the question or not. But let's hold on to these, and then if there's time at the end, maybe we can unmute people so we can get a little more detail. How's that?
Sounds good.
All right. All right. So you've created your single sign-on, you've got your Impact account, you have got access to the, let me just close up my chat box here. You've got access to the Impact implications application. So you've signed in. Here's your home page, and you'll see here, access your application. So you're going to hit Impact. And before we go into the individuals, I just wanted to give you an overview of the application process. So there's 16 steps. You'll see them all here. Ignore the highlighting. That was a screenshot and I couldn't seem to get the highlighting off. So I apologize for that lack of technological skill. So there's a number of steps, and you'll see some are required that you have to fill out in order to complete the application, and some of them are optional. So we're not going to have time to go through all of these steps in today's presentation. We're going to go through the key ones that are very specific to DPP and DSMES, but I'll show you at the end the link to the full presentation on the Impact website, and they go through each individual step with some screenshots and slides, so that if you run into any, it's all fairly straightforward, but if you do run into any issues, you'll have that link to pull up those screenshots with the HFS commentary on them. And here it is visually, and I just wanted to show you what we're going to go through today. So again, you've created your Impact account. Now we're starting the application. These are the steps you're going to go through. You have to select your enrollment type. Then you're going to select your provider type, select your specialty. There is a step for subspecialties, but in this instance, there are no subspecialties. Then you're going to provide your licensing and certification information. And then you'll see there's some dots on this arrow. There's information that they're going to want to see about your overall organization, ownership structure, et cetera, et cetera. And then the final step is, once you've completed your application, you will get, once it's been processed by HFS, they will send you what's known as an HFS provider info sheet, information sheet. And it's really important when you get that you review it carefully and make sure that, you know, your TIN is correct, that your taxonomy code is correct, that all the information on that sheet is correct, because that is what is going to be put in the system and sent to the MCO. So you just want to do one last quality check to make sure all the information is correct. And if it's not, make sure you let HFS know as soon as possible. If you run into any issues, or you do see something that's incorrect on your provider information sheet, there is a provider impact email box, as well as a help desk. They are really pretty good about getting back to you timely. So the resources are there. And again, this is all on that Impact homepage as well. But they do have resources there to help you if you run into any specific questions. So that's just a visual of what we're going to go through and what the application process looks like. So let's go back. Here we are back at our home screen. We've signed in. We're going to hit Impact. The first thing you are going to see is this provider enrollment screen. We're going to go through the new enrollment because we're enrolling as a new provider. And again, even if you are already a provider in Impact, you are still enrolling as a new provider because HFS is requiring a whole new enrollment as a DPP provider. I just wanted to draw your attention to this, and you'll see at the end of the presentation, there is an opportunity to track your application. You'll get an application number when you finish and submit your application. So you can always go back in if you haven't heard anything, you know, to track where your application is in the HFS process. But for the purposes of today, we're going to hit that new enrollment. The first thing you're going to see is enrollment type. If you remember from that visual I showed, these are the different types of enrollment. For a DPP provider, you are a facility, agency, or organizational provider. So you're going to hit that radio button and hit next. And then you begin filling in all the basic information. So what's your organization's business name? What's your TIN? Here's where you're going to submit that new type 2 NPI number. And again, the email addresses that you want within your organization. And I would make sure that you include that Impact mailbox email. And then you're going to confirm, and you're just going to go through the rest of the screens as you, again, we don't have time to go through all the screens, unfortunately, today. But the next screen will be, so you've done your enrollment type. The next screen is going to ask you about provider type. Again, depending on the type of service you are providing, it's going to be either DPP or DSMES. Your specialty will be as a DPP provider organization. Again, there is no specialty. Here is the taxonomy code that you're going to submit when it asks for the taxonomy code. And you will have to have your certification or accreditation information handy at the very end to submit your am I saying? Input your certification information. And again, just a reminder, I really apologize. This should say encounter rate clinics, not just Fqhc. So it should say RHC, if you're a rural health clinic or any other type of clinic that gets paid the encounter rate, make sure you're using a distinct NPI number and registering as a separate or new provider under the impact system.
And Lindsay, that's just to be clear that it's because you get reimbursement outside of the encounter rate for these services.
Exactly. Yep. Exactly. Yep. Similar to the super substance use payment system, but great clarification. Thank you, Jenna. Just a note on licenses and certifications, so you know what to have handy when you get to that step in the application process. You're going to have to enter your DPRP organization code when it asks for that. And then it's going to ask for your expiration date. Just put 1 year, 12 months later. For DSMES, make sure that you have your certification organization number with the expiration date. That is what they're telling us right now is needed to show that you have the certification. But there may be a request to a follow-up request to email, your certification in a separate document to upload or send them your actual documents. But at this point, they're telling us all you'll need to do is enter that organization code with the expiration date. So going back to our menu of steps here, you've put in your basic information. You're going to put in all your locations. Someone had asked about rural health clinics. If you do have multiple locations where you provide services, you're going to enter those in. Your specialty, again, is going to be either a DPP or DSMES provider. You are going to upload your licensing information. And then you're just going to go through all these other required steps, like how you're going to submit your claims, information on the ownership of your organization, your taxonomy, et cetera, et cetera. So you're just going to go through all these steps. And again, this is the link to the actual application process presentation that HFS did when they first opened the impact system. So definitely when you get to these steps, have any questions, you can always just go to this link and they've got the slides, you can print them out and it'll walk you through any questions you may have. So assuming that you've gone through all those steps, and again, it's not super complicated or difficult, it's all fairly basic information. You're going to go through the enrollment checklist. That's the second to last step. It's going to ask you to go through. You're going to click on that and you're just going to check and make sure that you've completed all these steps. And when you see it says complete, you can just submit your enrollment application. That's the final step. And this is the message you're going to get. It's going to give you your application number, which obviously you want to keep handy. And that's the number when you go back to that first screen, when you want to track your application, you just put that application number in and it will tell you where you are in the process. And that is the final step in registering impact. So before we move to the MCO roster, which is somewhat easier and fewer steps, I should say, let's stick with impact and see what kind of impact questions we have.
Rebecca, can you read them off for us, please? Yeah, I'll
Sorry about that. I was double muted. Okay, so it takes so long to get enrolled with MCOs to be able to bill. Some do not backdate to the impact approval date. What do you guys do when you have a patient in need, but the provider is not approved in MCO?
Well, they, first of all, are required to backdate it to the impact approval date. So I would definitely, if you have a patient in need, you always want to be providing services and you want to keep submitting claims. Don't hold claims. You may get denied, but better to get denied and be in the queue than to hold those claims. My best suggestion is to work with your provider rep This may have something to do with the roster and when the roster got loaded. So, and we'll talk about that in a little bit with the roster, but it could be a question of when you submitted your roster as well. So, but let me answer this a little bit more clearly when we get to the roster, because it could have something to do when your roster got loaded and when you submitted your roster. But definitely always work with your PR rep to find out what's going on. But assuming that you submitted your roster at the same time you did your impact registration, they are supposed to backdate that. The go live date for that provider should be when impact was approved.
Great. You may have answered this, but we have to be a certified facility provider for DPP, DSMES services, correct?
Yes.
Will RDs, CDEs, and RDNs also need to be enrolled with impact for them to bill for DPP, DSMES services under the organization, i.e. clinics, Fqhcs, et cetera?
No, the only organization or the only entity that has to credential is the billing organization. So there is no quote unquote rendering provider. When you think about claim, a medical claim, there's a billing provider, and then oftentimes there's a rendering provider of who actually provided the services. In the case of this group of services, there is only the billing provider. So any of the clinicians actually providing the services do not need to register an impact. They will not be on the claim. It will only be the organization itself.
And this is Jana. I'll just add that part of that is because the CDC recognizes diabetes prevention program, you already are verifying with the CDC that the people delivering the program have been trained in the standard curriculum and are meeting all of the standards of the program. So HFS, as long as you have CDC recognition, they're trusting that CDC is monitoring that and they don't have to. And same with the ADA and ADCS. You know, if you're meeting the national standards with which requires certain types of people to provide the services, then again, you just bill at the organization level.
Great clarification. Yep, that's great context.
Great. Is there support for nonprofits to tap into to assist with this process? Too many orgs such as YMCA's, this is a foreign language.
Yeah, I hear you. It is, if you're not used to medical billing, I'm sure it's making your head explode right now. Jana, I'm not sure.
Yeah, I can answer that real quick.
Yeah, that might be more for you than for me.
Through both of the CDC grants, the IDPH and IPHI have a new grant coming soon. There will be some assistance to help some providers along. So may not be necessarily financial, but there will be some TA coming for those who may need it. So we'll get more information about that soon. And of course, this training is one aspect of that.
Next question is, will each clinician with a Fqhc facility have to re-register an impact or just update on MCO's universal roster?
So this goes back to the previous question. Individual clinicians do not have to register an impact. Again, it's only in this specific instance, the Fqhc with that new NPI number and taxonomy code. And that's all that will go on the universal roster as well. There will not be any requirement to add individual clinicians on the universal roster. It's all at the organizational level.
What date can this be initiated? Is this date effective to apply?
What date can this be initiated? Well, I think the service goes live when, Jana, isn't it?
The provider has said as of August 1st, so you should be able to.
That's what I thought, it was backdated. So you should be able to, I mean, this is all ready to go within the impact system. So you should be able to start this today if you wanted to. And the way it works, we'll get to this in the universal roster, but in terms of your effective date to bill for services, it is based on when you get it credentialed by the state. But I'll talk a little bit more about that when we get to the MCO roster. But in terms of the impact submission and the MCO roster process, you guys can get started on that today.
If you provide both DPP and DSMES, can you enroll for both services within the same application?
I believe you can, yes.
And the final question for now is Fqhc reimbursement outside of the encounter rate. This means bill without the T1015, or is there a modifier?
Yes, you will not be billing for these services as an encounter rate clinic, whether you're FQ or rural health clinic. You will not be building the T1015. This will be a separate HCPCS code that Jana showed a little bit earlier in her slides that was in the HFS notice. And we'll talk a little bit more about that in the September sessions. But this is a separate billing process. So that's not an encounter rate service. You get billed and paid separately outside the encounter rate.
And as someone pointed out in the chat, you can't actually start this impact enrollment today because we have to go get a separate NPI number, which will take 30 to 60
Oh, yes, good point. Although NPI, usually they'll turn them around pretty quick. You can usually get those within a week or two. They're really pretty quick turnaround.
And do you think impact will backdate these enrollments to 8/1 or no?
You know what, that I don't know. That's really an HFS question. Jana or Jill, maybe we need to follow up. I can't remember if the provider notice made mention of that or not.
Yeah, I'm not sure. One last clarification that just came through. If the organization already has an NPI, we need to obtain another one, correct?
Yes.
I think that's all for now if you want to move on.
Oh. Okie dokie. Sorry, I gotta close my chat box here. Okay. So you've submitted your application. Oops. In impact. Now we're going to talk about the universal roster, which is a process that you should do really concurrently with your impact registration. Just a reminder, impact is just credentialing you, just letting MCOs and Medicaid recipients know that you have the requisite certification. You are then going to submit a few more pieces of information to the MCOs with whom you have contracts. And so some of you, it sounds like we've got a lot of encounter rate clinics probably already have contracts with MCOs. For our friends at the YMCA, you likely do not. So you're probably going to have to start outreaching to the MCOs to talk about contracting. For those that already are contracted, you're going to have to do an update to your universal roster. So just a reminder, the universal roster or the standardized roster is just that. It is a single roster that is accepted by all the MCOs I mentioned earlier. There is no deviations. Everyone uses the same roster information. It can be found on the IMHIP website. There is an Excel spreadsheet. You just have to click on that and it will give you the roster itself. It's an inputable template that you just fill in. And it's really looking for some information that the MCOs either do not get from the impact file when the state sends it over to them, or it's information that impact doesn't ask for, but there's rules and regulations and statutes that the MCOs have to follow in terms of what goes on their provider rosters, things related to accessibility for those with disabilities, et cetera, et cetera. So there's just some information that they need to have in order to fulfill contract requirements and legal requirements. Today's training is going to be very high level. Most of the MCOs, the provider reps, are very happy to help you if you run into problems with the roster. IMHIP also has a training that they do. So there's lots of resources out there if you do need it. But again, it's a fairly simple spreadsheet to fill out, and you've done the hard work by going through the impact system. So hopefully you won't run into any issues. So here's where we get into the backdating and everything. it's really important that you submit your universal roster to the MCO at the same time as you complete your impact registration. Because of when the effective date starts, and we'll talk about that in just a sec. Universal rosters, generally, MCOs will want to see them on a monthly basis. In your case, with this type of service, I would think it would just be quarterly, because you're really not going to have changes. The changes usually come on the actual individual provider level, which you're not going to have to provide. So you really probably only will need to update or send a roster on a quarterly basis. You should check, again, it's a universal roster, but always check with the plans that you're contracted with to see how they like to receive the files and how often they receive the files. Once the MCO receives the roster, they have 30 days to load it. Their systems will take 30 days to load the roster. You have to use the roster format that's provided by IMHIP, which is the Association of Medicaid Health Plans. When you see the template, and I'll show it to you in a sec, it's really important. You cannot delete columns or any of the headers. You have to maintain all those columns, and you don't hide them or anything, because this is a very automated process on the MCO side when they load it into their system. So they have to see all those columns or it won't load properly. If there are fields in the roster that are not applicable to you, they should be left blank. Do not put in not applicable or any kind of language in there. Again, because it's an automated process, if the system sees something in that doesn't recognize, it's going to spit it back out. You can add additional rows or lines to the roster though. So, if you're an organization that has multiple locations, you can add lines to identify all those different locations. Just do not touch or hide the columns or headers. And it's really important that you stick to that template and you stick to those rules, because if anything comes back and the system spits it out, they cannot load it without all the complete information. So it's really important you follow the template in the roster. I think I've covered this. The format and the structure is all the same, but always talk to your provider relations representative. Different plans will want you to submit it in different ways, or have a specific person they want you to send them to. There are FAQs on the IMHIP website by MCO that you may want to check out. Again, the resources are all there if you need it. But again, submit this roster at the same time as your impact registration. And this gets to the question that someone asked earlier. The effective date, when you become effective as a provider and you can submit a claim for services, is dependent on when certain steps happen. So it's going to be the later of when you have a contract. So you could have your impact registration done and submitted the roster, but if you don't have a contract, you're not going to be effective. So it's always going to be based on when you have a contract. It's going to be either the date that the provider is contracted, the date the provider is effective in impact, so when you get approved by the impact system, or the date the roster is submitted. So we say to submit the roster at the same time, because what the MCOs will do is, if you submit your application to impact and you submit your roster at the same time, the MCO will start presuming you're contracted, the MCO is going to start loading that roster right away. Even though you're not effective in impact yet, they'll begin that loading process of the roster, and it just will sit in their system in sort of a penned status. And when the impact file, when your impact registration is approved and the state sends over that impact file and it matches up with your roster, you become effective. The last thing you want to do is submit your impact registration wait for the registration to become effective, and then submit your roster, because then you're going to have to wait another 30 days for the MCO to load it. So it's really important. Submit that roster at the same time. It's all the same information. They'll just get it loaded so it's ready to go, so that once that impact registration gets approved by the state, you're effective, you can provide service, and you can bill for that service. So I'm going to pause there because it does get confusing, and I want to make sure that, because the question came up earlier, if that helps folks understand the timing of all this and why you want to do the roster at the same time as impact. Because the impact approval process can take 30 to 45 days, sometimes up to 60, depending on how backlogged they are. And this does not include the question of backdating to August 1st. We need to double check on that.
One question I have, I think you've answered this, is do you submit the roster to each MCO individually, or is there one spot you submit it to all MCOs?
No, that's a great question. No, you do have to submit it individually to each plan, because not every provider contracts with every plan. Like if you're a provider in Southern Illinois, and just because of the way they accept the plans, accept the rosters, you will have to submit it to each individual plan. That's why I said, you need to talk to, when you contract, for those that are new to this, when you contract with an MCO, you are assigned what's called a provider relations representative. And that's who you work with on issues like, claims or the roster. If you're having issues with billing and all that, there's a person, your provider representative, who will help you with all of that. So yes, you will need to submit the roster to each individual plan.
There's another question. Is there a way to confirm they received the roster? They've had MCOs claim that they never received it, which then moves the submitted date way past the impact approval date.
Yeah, you can ask, you can now ask when they have loaded the roster, you need to ask for an echo back report. And that will, that shows you that you've been loaded into their system. And here's the other thing I would do too: document. So if you send an email with your roster, say your plan says, send your roster to this email, make sure you blind copy or save a copy of that email, so that you have documentation that shows, if they come back and say, well, we never received it, you can show, this is the date I sent it, here's the email. But you can ask for what's called an echo, like echo back report.
Another question that came in, is the contract specific to DSMES? Or if my organization has an existing contract with DSMES being included?
Yeah, that's a question again for your provider rep. So if you already have a contract with the plan, because this is a new provider type, each contract is going to be, I don't know what's in your contract and what it covers. So I would definitely talk to your provider rep to make sure that you let them know that you will be enrolling as this type of, for this service and this provider type, because it will depend on what your contract says. So that's really a conversation between the provider and the plan and what's in the contract.
I'm seeing some chatter in the chat box just around the length of time it's taking. It's not taking under 30 days. It seems to be taking 30 to 90 days for MCOs to load rosters right now. Is what the chatter is, but said just keep working with MCO to get it done.
Yeah, Jill, correct me if I'm wrong, but I think their contractual requirement is 30 days. I know Meridian has had some trouble because there's been so much merger and acquisition activity in the health plans lately, which means changing systems. And I know Meridian was very behind because they had to switch over the provider database system they were using to their new corporate parent. So but my last communication with them was that they were pretty much caught up now.
Those are all the questions for now.
Okay. All right, so the universal roster, again, you download the template. It's really just an Excel workbook with a bunch of tabs along the bottom. The first tab you'll see is called instructions, and it's going to give you all the definitions that go with the workbook and just a basic outline of how to complete the workbook. For you guys, it's going to be fairly simple because you're really only going to be working in one tab. There's 3 different sections depending on the type of provider you are. There's one for individual practitioners, one for groups and locations, which is what this service type is, and one for facilities like hospitals, nursing homes, et cetera, et cetera. So you're really only going to be working in the group location tab. And that the green tab is where you're going to input the information. But before that green tab, you're going to see a corresponding tab with the same title that's going to give you very detailed instructions on how to complete each field. Within the input tab, each seat will have certain fields that are a drop down. So when there is a drop down, use the drop down. Sometimes it's a yes, no, male, female, etc. But if there is a drop down, please use the drop down. And then some are free text, but you'll see in a second that they tell you how to submit free text as well. So let's take a look. Again, you will be working in the group and location tab. You don't have to worry about practitioners because we're not putting in any individual RNs or diabetes educators, et cetera. And of course, we're not large facilities. So we don't need to do that. We've already talked about that. Okay, so here's when you open it up, you're going to see these 3 tabs along the bottom, or these 6 tabs, I guess. The instructions tab is just sort of a glossary of terms and some basic intro instructions, but definitely take a look at that. And you can see here's practitioner, here's group location, and here's facility. So the green tab is going to be the one where you input the information. Point on that one. And the white tab is going to tell you specific instructions. And so right now we are looking at the group location instructions tab, this tab right here. Green is where you're inputting. The one just before it is going to give you specific information on each of the fields. So you will see here is the field they're going to be asking for in the spreadsheet. It's going to tell you whether they're looking for text or a number. It's going to tell you whether it's required or only if it's applicable. And again, if it's not applicable for you, do not put NA, just leave it blank. And then if it's a free text field, it will tell you how they want to see, like for phone numbers, they want to see the phone number in that format, not with brackets or all together, just to make sure it loads correctly. So it's going to be very specific. So you can see, you want your zip code is going to be a numerical, it's required, and this is how they want to see it, etc. Trying to see if there's tax identification number obviously is important. Numerical, it is required. And they want the tax ID that's used for billing. No dashes, nothing, just straight up TIN number without dashes.
Question on this. If you are, let's say a YMCA and your address, your headquarter office is one address, but you're delivering the program at a local Y at a different address, are you putting the delivery site address?
Yeah, and it will show you. So location information, that is where you can add those rows, right? So you may have 4 different locations where you are providing, and this is important because unfortunately I cut this off, but it's going to show you G, this column here, when it has an X, that's what's going to be, I think it's the X, I apologize because I cut off the column header, unfortunately. But you're going to add all the locations where you provide the service. And then if you have the headquarters where you want the billing to go, that's where this, so you can see along the side, here's location information, here's billing information.
Great, thank you.
Does that answer your question?
Yes.
Yeah, because the TIN, this is what you've put in. So this billing information, that's what you would have put in impact. Because that's the organization that is, you know, gonna send the claims out and where the money is gonna go to. The location is just where those services are provided. So you could have, you know, like I said, 2, 3, 4, however many different places you think you're going to be providing the service. So this is when we've actually now gone into the group location input tab. And here are the things: location name, address, city, state, zip, all those things that were on the left-hand column, you'll see are now across the top. And that's where you're going to list all your locations, etc. And you'll see it goes along. It's a fairly straightforward spreadsheet. I mean, it's onerous in the sense that it's a lot of, you know, typing in, but it's not super complicated. And if you know, you can always go back to the instructions here or the group location specific instructions as well. So again, don't hide any of these columns, even if they don't apply. Just make sure they're all showing. If something does not apply, just leave it blank. Some of them, again, you'll see will have a drop down. Please use the drop down if you see the drop down in the box as you hit it. And that's the universal roster. So do we have, we can open it up now for just general conversation, questions or concerns or.
Can you talk about the sort of service location codes that were in the provider notes, and if you're, just as you refer to the universal roster, like, do you have to put that?
Yeah, that's not, yeah, that's actually, you're talking about place of service codes like 099, and
Yeah.
that will come up in the billing portion. When
Okay.
you actually submit the claim. There is nothing in the roster or impact that you will need the place of service codes for. That's specific to billing and claims. I see one here. We're registering our organization for impact, but we are supplying the MCOs with a complete of our providers. No, I should have clarified that. Your impact registration is for your organization. The roster is for your organization. You would not, in neither place, either in impact or the roster, do you need to list your RNs, your diabetes specialists, your community health workers, whoever you may have on your team. You only need to put the organizational information. What you'll want to put in both the impact and in the roster is if you are going to provide this service in different locations. You know, you may have 4 different settings where you're going to provide it. You'll want to make sure that for sure you put that in the universal roster, because that goes out in their provider directory, so members can see, oh, I need diabetes education, here's a location near me. So you want to make sure that, you know, they are listed in the roster, and you will probably need to list them in the impact system as well. But in neither place do you need to list individual clinicians.
And Lindsay, if you're only offering these services with telehealth right now, and you only ever plan to do the telehealth version, I know you can bill with the telehealth modifier, but do you need to note that in the location so that it's a telehealth? Would you just put your main headquarters office, or how would that work?
Yeah, I would just put your headquarters off, because individual like geographic locations are not important. You're just going to be billing all throughout from one location.
Okay. And someone asked, can you explain why we need another type 2 MPI?
I'm sorry, is there a way? Sorry, what was the question? Sorry.
It says, can you explain why we need another type 2 MPI?
That is an HFS decision. I have not, that is just the instructions from I do think it's for the Fqhcs and encounter rate clinics, because you're going to be paid outside of the encounter rate. The NPI that you have now for your medical and behavioral health services obviously are being paid at encounter rate. This is not being paid in that encounter rate system. So it has to be a separate provider registration.
And someone asked about do we know what the billing codes are going to be? And yes, they're in the provider notice, so the Fqhc codes.
Yeah, exactly. And we'll go through all of that in the claims presentation, what all the different billable codes are. But it is in the provider notice if you wanted to take another look. And yes, you will use for these services. It's Carol Andrews. I know Carol Andrews. Hi, Carol. Yes, it will be another taxonomy code. So you're going to get your new NPI. You're going to register in impact with that 174, whatever that that taxonomy code was listed. I haven't memorized it yet. So if you were an Fqhc that decided to provide the substance abuse disorder services, it's very similar. It's the same thing. You had to get a new NPI. You had to register as a super provider with a different taxonomy. It's exactly the same.
And for those wondering, I just put the link to the provider notice in the chat. So if you want to access the provider notice, you can click that link. And that includes the billing code. Jill,
And someone asked where,
oh, go ahead.
sorry, just someone asked where the codes are located, and they apologized for having a bad connection.
It's in the provider notice, which we linked to. I was just going to ask Jill, did you want to add anything about the type 2, the needing another NPI?
No, I think you explained it well.
We're having to take more questions if folks have them. So as we wrap up, we will send a PDF of all the slides shared today and a link to the recording to everyone so you can reference it later. And we also will put the recording up on a publicly available YouTube link so that folks can access it who weren't.
Sorry. Yeah, definitely. I just saw Julie Walsh at one point said, can you go back to the last 2 screens? And I want to make sure we covered whatever it was she needed to see on those 2 screens, or is the copy of the slides going to help? I just want to make sure we answer.
Oh, that was hi. That was actually from like much earlier in the whole presentation. So that's okay. You were just going through the steps of the registration process, and I was taking screenshots of it, but I'm good.
Yeah, I'm going to make sure that the animations are pulled out so that you see each individual screenshot. And again, I didn't show all the steps, but the link that I sent that has the FAO, I think it says Impact FAO, it'll show every single screenshot as you go through the process. So, you know, if you run into any issues, you can always just have a copy of that presentation handy. But I'll make sure that each screenshot that I showed is in the slides we send out.
Great, thank you.
Mm-hmm.
Again, if anyone is interested in providing these services but does not yet have CDC recognition or ADA, ADCES recognition, there are whole websites of what you need to go through with each of those organizations to get accredited, recognized, certified, depending on which org it is. And so if you need connection to that, let us know. But or if you're a DSMES provider and you want to start providing DPP or vice versa, you can look into what it takes to meet those standards and get accredited.
But this is Alyssa Bassler. I would just add Medicaid will pay for any level of recognition from CDC, from what they call preliminary to, I think, permanent or something. So to get the very first level of recognition is just going and signing up on the website. You have to then get your coach trained in the appropriate curriculum and things like that. but the becoming that very first level of recognition and getting started on this as far as the DPP goes is really really simple. But you have to have a plan then to also get your coach. It says you're gonna, use a certified coach and things like that. So, and as Jana said, we can help with sort of referring people to where to get coach training and things like that.
And I would also say that if, once you get the slides and you go through them, if you do have questions, and Jana, I hate to put you on the spot, but you can always email Jana and, she can reach out to Jill and myself and we can track down some answers, or might be able to just answer them right away. I do want to go back and check on that August 1st. Jill, I think you said it didn't say anything in the provider notice, and I can't remember how they've done it in the past. So
Yeah, I can't remember either. We'll
we do
definitely
need
have
to follow up
ask.
on that one.
Yeah.
But, I know someone asked about TA, and, if there's just quick questions you have, I'm happy to answer them. Jana, just forward them on to me. And
So I just put my email in the chat box for anyone who wishes to let us know what you need. Well, thank you so much, Lindsay, for this today. I hope it was useful for everyone. I see lots of thanks in the chat box. We really appreciate everyone's time today, and look forward to the trainings again in September, which is specifically around how to submit bill claims for Medicaid. So we look forward to having you on those trainings in September, and we will be in touch. Thank you so much. Oh, and someone just wanted to confirm the new program is geared towards adults only, correct? Not children. Yes, it is 18 to 64-year-olds. All right, great. Thank you so much, everyone. Have a good rest of your day.
thank you.
All right.